Welcome to Enduring Training for Directly Observed Therapy Workers. This is Lesson 12, Summary. The learning objectives for this lesson is to discuss a summary of providing directly observed therapy training. Here's a summary of the course outline. This was Lesson 2, TB 101 for Directly Observed Therapy Workers. In this lesson, we define TB as an airborne mycobacterium disease most commonly found in the lungs, but it can make its way anywhere in the body. TB is spread when a person with infectious TB coughs, sneezes, speaks, or sings. TB infection is not contagious. Patients are not symptomatic. Patients will have a positive skin test, or IGRA, a normal chest x-ray, and a negative sputum. TB disease may be infectious, may have a positive test, may have an abnormal chest x-ray with a positive sputum. Treatment is available for TB infection and TB disease. Lesson 3, Role of the Directly Observed Therapy Worker. Check for side effects, verify medications, watch the patient take, swallow the medications, document the visit, check in on the patient's well-being, assess social service needs, provide encouragement, provide education, provide incentives and enablers as needed. Lesson 4, Overview of anti-TB medications. The first-line medications are isoniazid, rifampin, ethambutol, pyrazinamide, and sometimes rifabutin, commonly referred to as RIPE. Second-line medications are cycloserine, ethionamide, levofloxacin, moxifloxacin, amikacin, capreomycin, streptomycin, Pacer, and linezolid. Lesson 5, Providing Directly Observed Therapy. DOT is the standard of care. We need to provide contact information, provide education on tuberculosis, medications, side effects, isolation precautions, and the DOT process. And remember, DOT succeeds for one pivotal reason. DOT makes the healthcare system, not the patient, responsible for achieving a cure. Lesson 6, Providing Directly Observed Therapy, Directly Observed Preventative Therapy to Children. Directly Observed Preventative Therapy, or DOPT, also referred to as window prophylaxis, or window treatment. It's prescribed for patients under the age of 5 with a negative skin test or IGRA who is a contact to a person with confirmed infectious TB. It's important to build a partnership with the parents. Remember, medications can be delivered whole, halved, or crushed and mixed with food or drinks. Use incentives and positive reinforcements. Remember to include the parents' encouragement too. And do not redose a child who has spit up after taking medications. Monitoring for side effects. Remember to use visual and common language when referring to side effects. Tools for the Directly Observed Therapy Worker. Learning resources. You can access public health agencies, private corporations, and nonprofit organizations for learning resources. For teaching resources, look at findtbresources.org, YouTube, and the CDC website. For your DOT toolkit, include your incidentals, water and snack, preparing and mixing, bring an ice chest, have your patient's record, have an itinerary, your respiratory protection, incentives, and any additional supplies you may need. Lesson 9, Additional Duties. Provide education, collect sputum, draw blood, aid in the contact investigation process, screen contacts, social services, and provide transportation. Lesson 10, Field Safety. Your safety is as important as the work you do. Be sure to plan your visit, view the patient's chart, have an itinerary, show me the way, inspect your vehicle, and take a charged cell phone. Remember to use respiratory precaution measures. Remember to use caution when dealing with patients who have mental health issues, substance abuse issues, be mindful of conflict management strategies, and always use caution. Lesson 11, Cultural Competency. Culture is defined as the learned and shared values, beliefs, and meaning that form the lens or perspective through which an individual understands and interprets their experience. In a culturally competent environment, the clinician or healthcare worker recognizes the cultural, social context of the encounter and can negotiate among potential conflicts, conflicting interruptions, expectations, and beliefs. Essentially, know your cultural values, have awareness and acceptance of cultural differences, develop your own cultural knowledge, and adapt accordingly. Remember successful completion of this course. If you've made it this far, you've successfully completed this course. A certificate of completion will be awarded to you, and a letter of gratitude will also be included. So let's wrap it up. Please complete the course post-test and the post-self-assessment for this course, and email both completed forms to jquinn12@wgu.edu. Thank you. Thank you for taking the time to participate in this course. Thank you for your patience in working through the technical issues. Thank you for completing forms and providing your feedback. Who knows, maybe you'll see this course around again and you can tell people that you are one of the first to participate. Thank you.